Good afternoon, everyone.
Good afternoon.
I am Dr. Shibangi Das, DS Research Center. Yes, March is the Multiple Myeloma Awareness Month. It is a time that is dedicated for raising awareness regarding this type of blood cancer, promoting uh, and encouraging the early detection, research on this disease, supporting patients and their family members. Awareness months of these types help not only understanding the disease, it also encourages patients to feel less isolated and connected more globally. Because when a person doesn't know what is he or she suffering with and how to deal with it, it creates more sense of being lost. So DS Research Center has been organizing these awareness webinars and events so that we can get connected to patients and help them and their families as well. In that sequence, we have this webinar that addresses awareness regarding multiple myeloma. With today, I have Dr. Shabnam from DSR Research Center, Guwahati, and Dr. Kashika Singh from DS Research Center, Varanasi. Welcome, doctors.
Thank you.
Thank you so much.
So, doctors, today we'll be discussing about multiple myeloma and we'll try to address the common questions that come up and how to deal with it. So I'll start with Dr. Shabnam. Dr. Shabnam, please tell me what is this multiple myeloma? What type of cancer it is?
So, as this awareness month is all about multiple myeloma, so today I will say it in a very simple language, like what is multiple myeloma. So, this is a cancer, so which actually affects the plasma cells. So, it's also known as plasma cell myeloma. So, these plasma cells are present in the bone marrow of every human being. So, these plasma cells normally helps the body to fight against any infections which are caused by virus or bacteria. So once the plasma cells becomes cancerous or due to certain risk factors or certain mutations, the plasma cells may become malignant. So when the plasma cells become malignant or become cancerous, it's also known as myeloma cells. So a plasma cell is called a myeloma once it is converted to cancer form. So it is also called multiple because it occurs in the various parts of the bone marrow. So these plasma cells, once it mutates or once it get malignant, it changes to myeloma. So this term is used only for the plasma cells of the bone marrow. So normally these cells are, as I told you, like this helps the body to fight against infection. It produces antibodies, certain proteins which are made by the plasma cells of the bone marrow. So these proteins helps in fighting the infections. So these are very good if it is in a very good condition, but when it becomes cancerous, it generally outcasts the normal immune cells of the body. So when it grows aggressively, so it gets converted to cancerous form, and that time you can say that this cancer is a myeloma. So that time when a patient comes and tell me like there are various way to find out what this type cancer, but this cancer is generally a cancer of the plasma cells that happens in the bone marrow. So we need to be very much aware that these cells, once it gets converted to cancer, we need to find out the exact cause of the cancer, how we can detect and what are the symptoms. We need to know that. So first of all, these are the things we need to know, that what is plasma cell myeloma, and it is actually termed as multiple for, as I told you, like it occurs in various parts of the bone marrow of the body. So as a result, normally the bone marrow of every human being, it produces very good healthy immune cells of the body. So once it get affected, it certain blood cancers get formed. So one of them is a multiple myeloma, which you can also say a blood cancer.
Okay, so let's elaborate more on signs and symptoms regarding this disease.
So this condition affects almost every part of the body, especially the bones. So the common signs and symptoms which we see in most of the 70% of the patients comes with lots of these complaints only, especially the back pain or the bone pain. The first primary symptoms you will see. The second is the persistent fatigue, and you can see the patient having lots of kidney complications, like they may have severe they may have urine incontinence, they may have dehydration, and there is a common acronym associated with this disease. This is crab, and this acronym, and from going by the first word is C, that is, like, you can see you will have hypercalcemia. Like there will be lots of calcium when you will be doing the calcium blood test, you will see lots of calcium cells, calcium getting elevated in the blood. Second is that what you can say, it's recurrent infections. R stands for the recurrent infection or persistent infection. Like why this infection is happening. The infection may be of pneumonia or UTI or any other infection, but that is going to be persistent, and it may be due to unexplained. May never know why this infection is happening. But in multiple myeloma, persistence and recurrent infections you will get to see. A is the anemia. So the multiple myeloma patient suffers severe anemia. So as you know, cancer also, in all type of cancer, anemia is common, but here the hemoglobin levels will be deliberately very low as compared to other cancer patients. And the third is the last is the bone pain or the bone lesion. Like by doing test, you will get to know that there are lots of lessons, or there will be bone pain, especially in the hip area or thigh region or near the shoulder or the legs and hands. There will be consistent pain and severe pain. So these are the common symptoms. Once we find out that these are the symptoms a patient is having, we need to be aware that this is a case of multiple myeloma. And there are other possible symptoms like nausea and constipation or tiredness or fatigue. There may be fatigue. So we need to be aware that these are also the symptoms of multiple myeloma. Patient may have most common, like is like that you'll find out the kidney complications is the main primary thing to rule out from other diseases. Like kidney disease is the most common complication, from 20 to 25% of the 20 to 25% of the patients mostly suffers from kidney complications. So kidney complication specifically rules out from other cancer. So this multiple myeloma patients in a longer run, if they're having these symptoms in a longer, if it is not treated, then what happened? They always suffers from kidney disease. So kidney disease is the ultimate complication of multiple myeloma. So we need to be aware about the signs and symptoms, and early symptoms detection is the best and final solution in the treatment of the multiple myeloma. As you know, multiple myeloma is incurable, but it is treatable with proper support of the healthcare professional. If you consult the healthcare professional, or if you consult the doctor, they will tell you they will give you a way to treat this cancer. So if anyone is having or suffering these symptoms, please come forward and let's stay together, and let's help us in fighting this disease together.
Sure, sure. So, this is also what I wanted to discuss with Dr. Kashika here. Dr. Kashika, why is it that the patients suffering from multiple myeloma are feeling tired, weak, a chronic fatigue develops in them, and how Ayurveda can help in this situation?
Sure, sure. So in Ayurveda, condition like multiple myeloma, we can understand it in broader spectrum by saying Majja Dhatu Dushti, which is mutation of bone marrow tissue, along with Ojashay, which is depletion of vital essence. So there are three mechanisms behind this fatigue and the constant weakness the patient feels. So the first thing is the dhatu share, which I said the tissue depletion is there. So asti, majja, all these dhatus, they are in constant depletion, loss. Body loses its structural strength. So the persistent fatigue, body ache, and lack of this physical stamina, this stays in the body. Now, Oj depletion. So Oj is the essence of all dhatus, like we all know. In Ayurveda, we say Oj is there, then the body can be sustained or the person can stay healthy and immunized. And there's also mental stability. So the Oj depletes, the patient starts to feel low on energy, immunity, and the mental stability also. So in chronic illness like this, OH gets gradually depleted, leading to extreme tiredness without exertion, feeling drained or lifeless. And obviously, low enthusiasm is there. Third thing is Agni Mandya, which is very, very important. And majorly, we talk about Agni in any patient, be it cancer patient or a normal patient also. If the digestive fire is low, the metabolic fire is low, when the Agni becomes weak, nutrients are not properly absorbed. So even if the patient is trying hard to take good diet and everything, even good food fails to nourish the body. So this leads to the cycle where the body is eating everything, taking the good diet, but not truly getting strength from it. So Ayurveda has a different approach, and a lot of things can be done to rebuild the patient's strength. First thing that we can do is a rasayana therapy, which is a rejuvenation approach in general. So it rebuilds dhatu and improves immunity along with maintaining the age of patient. Some classical herbs can be used, but definitely under supervision, not through self-medication, right? Ashwagandha and a lot of other drugs, they help, but they must be under constant guidance of a practitioner, Ayurveda practitioner, in right amount, right dose, right timing, right? Now for Agni Deepan, we truly believe that if we improve the Agni, things will work better. So we'll give Deepan Pachan drugs and kindle the Agni basically, so that anything that we are doing, the Bruhan Karam and everything, it works on patient. Along with it, Bruhan Karam will be given. And once the digestion improves, nourishing therapies are also given, right? So milk preparations, if patient is suitable for that, medicated ghee and all is given. And I would also say that if the patient has the immunity enough to take some mild panchkarma therapies, not extreme ones, to have like chronic things, we won't advise that. But if the patient can take it mild, to remove basically metabolic toxins. Pachan and removal is as important as kindling the Agni. Mind body support is given, and practices like very soft pranayam, meditation, positive health, and mental counseling. So it may help patient reduce the fatigue, improve the quality of life, and enhance the strength and resilience, which is required for the patient to tolerate other therapies also, along with staying a little healthy.
Okay, okay, great. Thank you for sharing this information with a very easy language, because it will be helpful for the patients. So now we understand what the disease is, what are the signs and symptoms, and why specifically we addressed fatigue and weakness. Because in common, when we try to understand any disease, we have to understand the strength of the Agni, the metabolic condition, because a repair that a body needs, that has to be internally materialized. So yes, Agni is one of the important part that has to be taken care for a good result in terms of treatment, in terms of recovery. Now we have to understand what are the methods by which multiple myeloma gets diagnosed. Dr. Shabnam, please explain the steps or the investigations those are done to diagnose multiple myeloma.
Yeah. So there are lots of tests to rule out multiple myeloma. So the first being the blood test. So we normally advise the complete blood count test to the patient, because we need to rule out that how much is the hemoglobin level, how much is the platelet level, because the multiple myeloma patients, the patients normally suffer from very low hemoglobin, very low platelet count, and they suffer from very low neutrophil count, and all the hematocrit value of the volume of the blood, or the total blood morphology gets changed. So we will advising this complete blood count test to test to access the blood count. Again, the second, the most important point is we advise the kidney function test. So in the kidney function test, we will try to access the glomerular filtration rate, the ZFR rate, what you can say, or to access the electrolyte balance, to access the serum creatinine levels, and also to access the free light chain, and also the urine electrophoresis test we advise in the as a part of the kidney panel test. So, second, as I said, after advising complete blood count test, the second is a kidney function test. We from through these two tests, we get at least a half a picture of the disease. Thirdly, is that we try to find out the access the value or the number of monoclonal proteins. So this monoclonal proteins is these are forms in the bone marrow by the cancerous plasma cells. So the cancerous plasma cells, whenever they get cancerous, they generally excrete lots of antibodies, and these antibodies are monoclonal proteins, and these proteins are of no use to the body. So these proteins generally elevates the calcium levels of the body. It generally disrupts the balance of the body. So to access the monoclonal proteins, we will be advising the urine electrophoresis. These are a group of blood and urine tests. So how to access the monoclonal proteins, we'll be advising blood and urine tests. The tests mostly are the serum quantitative immunoglobulin test, or you can say the serum protein electrophoresis test, or urine protein electrophoresis test, and again another free chain, what you can say the free chain electrophoresis test. So we will be advising this blood test and the urine test to access out the monoclonal protein, how much it has increased in the body. Again, the fourth most important thing is the bone marrow biopsy and bone marrow aspiration technique and the biopsy. By that technique, we can finally access or diagnose out the case of multiple myeloma. And the fifth most important thing is the X-rays. Normally, we can advise X-ray or CT scan or MRI, or you can say we can advise PET-CT also to the patients, and also the bone density test. So these are the some tests which we can access out, we can rule out the cause and rule out the disease, specifically multiple myeloma. So but whenever we see patients or consult a patient, we always they have this queries, right? How will you get to know what tests we need to do? So these are the common tests we need to do every year. Even if you're not having multiple myeloma, or even if you're diagnosed with multiple myeloma, please repeat this test every month, every week if you can, because this is a screening test to access out the multiple myeloma disease. Because once you start getting the symptoms, we normally ignore the symptoms, but try to do the test as a part of normal routine, like be it kidney test or be it urine test or be it every blood test, so that we can at least find out the possible cause of diseases.
Okay. Okay. So thank you, Dr. Shabnam. I understand that we are trying to reach more and more people and make them understand what early detection can do in terms of increasing the life expectancy of a patient that might come under this type of disease. So I'll move forward to Dr. Kashika in this. How Ayurveda can help a patient suffering multiple myeloma and also following the modern allopath treatment for it. How Ayurveda can help in this section.
See, from an Ayurvedic perspective, conditions like this reflected deep tissue and internal balance problem, right? So, particularly involving the bone marrow, immunity, and what we call ojas. So, the strength is completely depleted. Body becomes vulnerable. Now, not just physically, both emotionally and mentally as well. So the role of Ayurveda here is to strengthen the individual who is going through the disease through carefully selected treatment, herbs, and dietary guidance along with lifestyle practices. If the patient wishes to take the allopathic treatment along with this, Ayurveda aims to improve digestion, enhance immunity, and support the bone and tissue health. And most importantly, it helps the patient to tolerate the treatments like chemotherapy and make them more effective. And it can also play a meaningful role in reducing the common side effect, which is very, very common fatigue, like we talked about it, weakness and loss of appetite, and also similarly nerve related discomfort also happens in these type of cases, and even if the patient is taking any therapy, so thereby it will improve the quality of life. However, it is equally important, and I emphasize to everybody listening and watching that Ayurvedic interventions must be personalized and taken care under guidance of a qualified practitioner only, and with coordination with modern oncologist. Ayurveda will bring a holistic dimension to care of the patient, and it will remind us that while the disease is being treated, the person must also be nurtured. Because ultimately, healing is not just about eliminating the disease and illness, it's about restoring the balance, strength, and the sense of wholeness that a patient loses during any kind of disease.
Okay. Thank you, Dr. Kashika. So, as we are trying to understand that Ayurveda works on a whole, right? So, how diet and lifestyle changes can affect better recovery of patients suffering multiple myeloma?
So I will be just explaining a simple practical routine which is very easy for patient to follow in their daily life. So first I'll be talking about the diet. So Ayurveda emphasizes that the digestion is the root of health. So patient should always prefer warm, easily digestible food. There are certain examples that I will give that will help patients. It can be very simple moong dal khichdi. You do not always need a fancy dietitian or a fancy diet in terms of any cancer or anything. Something which is very general, helpful. Our ancestors have been doing it since very long. That can also be simply done at home and you can be well and good. So very simple. We were all said earlier, like जब भी हम बीमार होते हैं, we should be having light food like moong dal khichdi, as it's very light and easy to digest, and the body does not has to stress a lot to process the food, right? So it is the best food, I would say. Simple vegetable soups can be done, and freshly prepared meals are highly recommended instead of getting something packed, even if it says that it's very nutritious and everything. But I would say the patient who are the sufferers should always have a freshly prepared meal. Heavy, fried, processed should be out of their life, and it should be avoided every time, because definitely they will create toxins. They will effectively increase the arm in the body, and again the pachan and agni will slow down. So they can also include small amount of good foods, and it's also important that they add little cow's ghee and some soaked dry fruits, and every seeds that we take for good health. And warm milk with turmeric can be taken if the body suits. So basically it will help in reforming the ojas and the essence of immunity, and definitely will patient feel a better and bit strengthened. Secondly, it's equally important that we must protect and improve digestion. So, starting the day with warm water and using simple spices like cumin and coriander and fennel in cooking, it will make a big difference. Also, lifestyle is equally important, and we always say the body is under stress in disease. So, overexertion should be avoided. Gentle walking can be done, mild yoga, breathing exercises, anulom vilom, brahmari can help both body and mind, right? So, proper rest is essential. Sleeping on time is essential. Patient can ideally sleep by 10 if they're done with their work also, so it will support some natural healing. At the same time, excessive daytime sleeping should also be avoided, because in Charak Samhita it's as mentioned that the patient who is is only allowed to sleep during daytime in Grishma Ritu, or he's chronic illness patient. So I do not support that a patient should be sleeping much, because again it will slow down the metabolism. And most importantly, maintaining a calm and positive mind is crucial. Stress directly will affect the immunity. So practices meditation and simply spending good time with quality people, family, it's beneficial for patient. And we in Ayurveda, we always say that the therapies and everything, they should be taken under guidance only. So the light and key message for the patients and the people who are watching this is Healing is a gradual process. See, something will not happen overnight, but when the digestion improves, nourishment improves, the strength and immunity will definitely improve. And this is how the body becomes more capable of supporting recovery, even alongside of the modern treatment.
Great. Thank you, Dr. Kashika. Dr. Shabnam, would you like to add a few of your point of views regarding this supportive diet and lifestyle changes?
Yeah, sure. So yeah, as said by Dr. Kashika, say diet and lifestyle plays a very major role in any disease, not only in cancer, because nowadays in this world, see it's growing. It's like the world has modernized so much that we have ignored the common things like waking up early or working or taking care of our body. Now this has become a luxury item type, like taking care of a body is like buying a luxury item from a shopping mall or like that. So I would just I would like to add some few points, like the diet specifically. So better to opt for a home cooked food, which is very light, and which is good for the stomach. We should not, if you're being diagnosed, or if you come to know that you are having cancer, or if you are diagnosed with any disease, like specifically this multiple myeloma, in such patients we need to be aware about the diet also, because in diet it should be very much light and very much digesting capacity time, because digesting capacity metabolism becomes very low in such patients. So we need to focus on the diet, which is very simple, basic घर का खाना. So that will be very much good for you. We should not focus on the taste, because if it is tasty, then it's not going to add so much. It is not going to add the nutrition. So we need to take a very clean, healthy, and nutritious diet. You can have all the seasonal vegetables and fruits, which are specifically like after consulting a practitioner, they will normally prescribe you the diet. So the patient should follow the diet strictly. The seasonal vegetables and fruits should be taken. If We should try to omit the processed thing, be it maida or be it refined oil and all. So these things are not going to add value to your health, but these things are going to destroy your body. So we need to be we need to be very much serious about the diet. Second and most important thing is the physical activity. So nowadays the cancer is normally what happens, it affects the bone part. Normally what happens, this condition impacts specifically the bony regions of the bodies, it prevents the new bone cell formation, right? So it also suppresses the immune system. In multiple myeloma, the myeloma cells normally suppresses the immune system. It reduces the number of antibodies in the body, so the body doesn't have the capacity to fight a disease, infection or anything. The body is completely in the stress mode. The body has completely in the fight flight mode type. So the calcium levels are also increased in the blood, and you also see patients having lots of swelling in the hands, legs and body. There are also complaints of fatigue. They also complain of lots of symptoms, as I've already described earlier. So I can say you can't do exercise in that situation. So sometimes physical activity has to be done in a normal manner, just like as Dr. Kashika ma'am has told, like normal yoga, normal pranayam. So whatever it is suitable, we should avoid heavy exercise, so that because there are increased risks of fractures in multiple myeloma patients. If you're going to do over exercise, it may lead to fracture, it may cause fatigue of the bones. So we need to be very much aware about this disease, and we need to stay safe and be very aware about the thing that we can't do heavy lift exercise or go to gym after also knowing that you are having multiple myeloma. So you need to be aware that light physical activity, light diet, which is digestible, which is very nutritious for the body, is a focus on that. And thirdly, most important thing is I've always said in most of the webinars, and I will be repeating that again, that mental health plays a very important role in fighting or standing or in this journey of multiple myeloma. You have to be very much positive. You need to be very much strong to fight these diseases, because it takes a lot from the patient, not only physically, it also affects mentally, it also affects financially. So if you're having any issues, physically, mentally, or financially, please come forward to us. We are here to help you at DS Research Center. So from whatever we can do, we will be giving you the 100% the best advice to you and the best treatment to you. Because we being an Ayurveda Charya here, we are completely Ayurveda based, and Ayurveda believes in the natural healing. It whatever these modern treatments we are normally see, like chemo or immunotherapy, you can take, that's completely your choice. We are not forcing you to not take if you're completely focused on that. But if you also take our Ayurveda treatment side by side, it causes lots of miracles. So it helps the patient to recover very fast. So recovery is the only option which we can always which we always advise the patient. Like, we should always focus on the best treatment. We should also focus on in taking our care. So prevention is the best form of treatment. So if you are thinking like what is the best thing we can do, if we at least one day you get to know that you are having blood cancer, like multiple myeloma, you don't need to panic, you don't need to have anxiety, or you don't need to think once or twice, but you need to just consult a good doctor who are prescribed, who are specialized in this treatment. So once you talk with them, they will give you the whole picture. They will be telling you what to do, what not to do. You just have to follow the guidance. So that this diet and lifestyle, I always say, like, this should be always focused. Apart from medicines, okay, they are doing fine, they will give lots of benefits to you, but most of the patients, what they do, they just ignore the uh, process of what you can say, our advice. Like, they are completely focused on the medicine, and they always ignore the lifestyle advices because they think this is not going to work anyway. So it should not be like that. Along with medicines, the food and the lifestyle should be also kept side by side, should be given importance, because this eventually will add benefits to you in the longer run. If you're completely focused on medicines, that okay, let's take medicines, let's get treated with medicines only, then this is not going to work that way. You have also to be serious about your health, physically, mentally, and as I also said, mentally. Like, if you're stress free, your disease will you will get recovered very fast. Or if you're more in stress mode, like what to do, what not to do, then this disease is not this treatment is not going to work that way. So you need to keep this balance of treatment and the lifestyle and the food, and whatever we as a doctors will always prescribe, we always tell the patients to follow. You please follow those instructions very strictly. In this way, you can you can fight this in this type of diseases like multiple myeloma.
So that was a very nice and very easily understandable explanation and how you can deal with. So I understand that our viewers will come to know what is this disease. This is a disease which we count under blood cancer, but it affects the marrow and the health of bones in our body. So when we are talking about Ayurveda, it is Asthi and Majja Dhatu affecting disease. According to that, the symptoms come up, and how we need to address is another challenge. When a patient diagnosed with multiple myeloma, that patient can undergo chemotherapy, but should keep in mind that Ayurveda does help, because Ayurveda focuses on the exact requirement of the body to get itself healed. It focuses on the metabolic condition, on the Agni, that is part of the metabolic improvement, then Dhatu, Asti and Majja Dhatu, and Srotas. How we can reach up to this target of health is following the dietary guidelines that addresses the specific situation, and following a specific lifestyle, so that a complete, a roundabout healing can be achieved when a person is suffering cancer, be it multiple myeloma or any other type of cancer. So, complete recovery is possible with proper guidance, integration of types of treatment to fulfill the lackiness that lie in that specific type of treatment. So we need to work on that, and today's session gives a clear picture of what a patient or the family members can do to help themselves. So thank you, doctors. Thank you, Dr. Shabnam. Thank you, Dr. Kashika. We'll meet up again. Thank you for today's session. Thank you.